1. Which of the following anatomical terms best describes the motion in the picture above? And the correct answer is option
A. Adduction, B. Abduction, C. Supination, D. Pronation. And the correct answer is option
B. Abduction.
Guys, here our next question.
Which of the above locations represents the best sites to inspect chest retractions in a child with lower respiratory tract disorder? Answer. The options are A and B, B and C, C and D, D and E. And the correct answer is option D and E.
Guys, here our next question.
Your patient's finger stick blood sugar at 7:30 is 300 mg per deciliter. According to the following sliding scale, how many units you would give your patient? Answer. The options are A6 IU, B8 IU, C14 IU, D18 IU. And the correct answer is option C14 IU.
Guys, here our next question.
The nurse is caring for a diabetic child whose 11 am blood glucose monitoring check is 269 mg per deciliter. The physician orders the following coverage schedule. According to the coverage schedule, how many units you would give your patient? Answer. The options are A 4 units, B 6 units, C 8 units, D 10 units. And the correct answer is option B 6 units.
Guys, here our next question.
The following syringe contains morphine sulfate in a concentration of 2 mg per cc. How much total morphine the syringe contains? Answer. The options are A 0.5 mg, B 1 mg, C 2 mg, D 4 mg. And the correct answer is option D 4 mg.
Guys, here our next question.
Following syringe contains 2 gm of morphine sulfate. How many grams are there in 1 milliliter? Answer. The options are A 0.5 gm, B 1 gm, C 2 gm, D 4 gm. And the correct answer is option.
Guys, here our next question.
Following condition may develop in females due to an increase in the production of which of the following hormones? Answer. The options are A. Androgens, B. Progesterone, C. Estrogen, D. Growth. And the correct answer is option B. Progesterone.
Guys, here our next question.
What is the name of the process of movement of a dissolved substance, solutes, from an area of high concentration to an area of low concentration? Answer. The options are A. Effusion, B. Diffusion, C. Emulsion, D. Excretion. And the correct answer is option B. Diffusion.
Guys, here our next question.
Which of the following is the incision site for an open cholecystectomy operation? Answer. The options are A1, B2, C3, D4. And the correct answer is option B2.
Guys, here our next question.
Which of the following is the incision site for an open gastrectomy operation? Answer. The options are A1, B2, C3, D4. And the correct answer is option D4.
Guys, here our next question.
Which of the following is the incision site for surgical appendectomy operation? Answer. The options are AA, BB, CC, DD. And the correct answer is option CC.
Guys, here our next question.
What is the most probable type of arrhythmia in the following ECG lead? Answer. The options are A. Atrial fibrillation, B. Atrial flutter, C. Ventricular fibrillation, D. Supraventricular fibrillation. And the correct answer is option A. Atrial fibrillation.
Guys, here our next question.
What is the most probable type of arrhythmia in the following ECG lead V1? Answer. The options are A. Atrial fibrillation, B. Atrial flutter, C. Ventricular tachycardia, D. Supraventricular fibrillation. And the correct answer is option C. Ventricular tachycardia.
Guys, here our next question.
14. The following picture suggests that the patient has. Answer. The options are A. Renal disease, B. Hepatic disease, C. Pulmonary disease, D. Cerebral disease. And the correct answer is option C. Pulmonary disease.
Guys, here our next question.
When a patient is vomiting postoperatively, which of the following positions would the nurse use to protect the patient?
Guys, here are next question.
In the following picture represents the pain distribution of which nerve affection? Answer the options are AC2, BC6, CT3, DT6, and the correct answer is option BC6.
Guys, here are next question.
18 on assessing the client's pressure ulcer, see photo, the nurse would document. This is which stage? Answer the options are A stage 1, B stage 2, C stage 3, D stage 4, and the correct answer is option C stage 3.
Guys, here are next question.
See what is the name of the equipment this picture shows. Answer the options are A oropharyngeal airway, OPA, B nasopharyngeal airway, NPA, C laryngeal mask airway, LMA, D urinary catheter, and the correct answer is option B nasopharyngeal airway, NPA.
Guys, here are next question.
Client is being prepared for a thoracentesis. A nurse assists the client to which position for the procedure? Answer the options are A lying in bed on the affected side, B lying in bed on the unaffected side, C Sims position with the head of the bed flat, D prone with the head turned to the side and supported by a pillow, and the correct answer is option B lying in bed on the unaffected side.
Guys, here are next question.
A nurse is preparing to insert a nasogastric tube into a client. The nurse places the client in which position for insertion? Answer the options are A right side, C high Fowler's, B low Fowler's, D supine with the head flat, and the correct answer is option C high Fowler's.
Guys, here are next question.
Nurse develops a plan of care for a client with deep vein thrombosis. Which client position or activity in the plan will be included? Answer the options are A out of bed activities as desired, B bed rest with the affected extremity kept flat, C bed rest with elevation of the affected extremity, D bed rest with the affected extremity in a dependent position. And the correct answer is option C bed rest with elevation of the affected extremity.
Guys, here are next question.
Client in labor is transported to the delivery room and is prepared for a cesarean delivery. The client is transferred to the delivery room table, and the nurse places the client in THE. Answer the options are A Trendelenburg's position with the legs in stirrups, B semi-Fowler position with a pillow under the knees, C prone position with the legs separated and elevated, D supine position with a wedge under the right hip. And the correct answer is option D supine position with a wedge under the right hip.
Guys, here are next question.
25 The nurse is caring for a client who is 1 day postoperative for a total hip replacement. Which is the best position in which the nurse should place the client? Answer the options are A side lying on the operative side, B on the non-operative side with the legs abducted, C side lying with the affected leg internally rotated, D side lying with the affected leg externally rotated, and the correct answer is option B on the non-operative side with the legs abducted.
Guys, here are next question.
Which of the following is the best position to increase the brain perfusion, cerebral perfusion? Answer the options are A prone, C semi-Fowler's, B supine, D Trendelenburg's, and the correct answer is option D Trendelenburg's.
Guys, here are next question.
Client has just returned to a nursing unit after an above-knee amputation of the right leg. A nurse places the client in which position? Answer the options are A prone, B reverse Trendelenburg's, C supine, with the amputated limb flat on the bed, D supine, with the amputated limb supported with pillows, and the correct answer is option D supine, with the amputated limb supported with pillows.
Guys, here are next question.
A nurse is caring for a client with a severe burn who is scheduled for an autograft to be placed on the lower extremity. The nurse develops a postoperative plan of care for the client and includes which of the following in the plan? Answer the options are A maintain the client in a prone position, B elevate and immobilize the grafted extremity, C maintain the surgical extremity in a flat position, D keep the surgical extremity covered with a blanket, and the correct answer is option B elevate and immobilize the grafted extremity.
Guys, here are next question.
nurse is preparing to care for a client who has returned to the nursing unit following cardiac catheterization performed through the femoral artery. The nurse checks the physician's prescription and plans to allow which client position or activity following the procedure. Answer. The options are A. Bed rest in high Fowler's position. B. Bed rest with bathroom privileges only. C. Bed rest with head elevation at 60 degrees. D. Bed rest with head elevation no greater than 30 degrees. And the correct answer is option D. Bed rest with head elevation no greater than 30 degrees.